You are watching the Doctalk show.
Welcome back from that short break. It is me, your host, Dr. Joseph Ogavu Jagenda, and with someone from the Ministry of Health, Dr. Alfred Tuare. As promised, this year, specifically this month of October, the Ministry is targeting very big achievements. Despite the fact that we've had COVID, we actually want to make very big gains for the country. And Doctor, I'm looking at cancer of the cervix. My area of practice, nephrology and internal medicine, I see quite a number of women who come in rather late with a diagnosis of cancer of the cervix, cancer of the womb. And it's quite a very debilitating disease with many complications, which are very difficult to manage and very demeaning of anyone's stature and very expensive to manage. I mean, you're talking about someone needing dialysis for the rest of their lives or needing very complex surgery to try and save their lives or get them to function better. Again, what targets are we looking at for prevention of this cancer of the cervix, especially through vaccination with HPV?
Yes, Dr. Gavo, I think the crux of the matter is the diseases which have been prioritized to be prevented through vaccines are diseases which once get somebody, there is hopelessness in the treatment and the outcomes. So the best is either to invest in health promotion and disease prevention. So the promotion side will be adaptation to behavior and behavior. For example, cancer of the cervix, we know that its occurrence is, there are associations. Early sexual debut, starting sexual activity early is a risk. So by behavior, it is good to delay.
Yes.
Number two, multiple sexual partners is a risk. So it is also good to delay. The parity, having multiple pregnancies is also a risk. So through family planning, adaptation of behavior, you can actually prevent the disease at the health promotional level. The one now we are talking about is, we also know that the cancer of cervix is caused, there is also a very strong association or a cause with the human papillomavirus. HPV. Now, we know that this is one of the interventions where we can prevent that disease. And you have explained the suffering people who have already got this disease go through. And I think it is safer now that there is an intervention. We introduced this vaccine into our routine immunization program about 5 years ago. Now, the earlier children did not have this opportunity. Now the children we are having, this should not be one of their diseases.
And we are looking at the cancer that actually is the commonest cancer in women. That's cancer of the cervix. Mark you women, every woman that has normal anatomy, you probably have a uterus. And that means you stand a high chance of getting cancer of the cervix. So every woman has a chance of getting cancer of the cervix, and this vaccination actually reduces the chances of you getting this virus and therefore getting cancer of the cervix. And I want us to look at numbers. How many people are we looking at preventing getting this cancer by this vaccination?
Activity? Yes. So you may remember last year we had measles rubella campaign during the month of October. And that is the month where we normally vaccinate children who are 10 years of age, girls. We missed it because of that campaign. This year in April, Child Health Days, we intended to vaccinate We did not also because of the lockdown.
Then came COVID.
Yes, because of COVID. Now, this October, it means we want to vaccinate children whom we should have vaccinated in October.
So you want to do a catch-up?
It's now a catch-up. October, November, and October. So we have a total of about 1,200,000 children to be vaccinated.
1,200,000
countrywide.
children. Please stand and be counted among these that will be vaccinated. If you're a parent, you want to help this girl child to evade this cancer of cervix.
And this is very expensive.
Oh, yeah.
This
I've been looking at the figures, and that's about $4,
$4
per
per dose.
You are talking billions.
And 2 doses for a child. And the government has committed to ensure that these vaccines are available for the children in the country. So we should seize this opportunity to prevent this deadly cancer.
I see. So one maxim when we were in school was that every African has worms in their intestines. You find them, deworm them. So our population is about half below 15 years of age. And I'm amazed that you're targeting quite a big number for deworming. Just a simple pill to take away the people that are sucking blood in your, in your intestines. Actually, we've seen very gruesome images of people having blocked intestines because of worms, and this can be sorted by just a single pill of albendazole. How many people are we targeting to give this pill?
You know, again, we missed the children who are 15 years. Our target would be from 14 below, but we're doing a catch-up on those who missed.
Added 1 year.
We have added 1 year. So we want to deworm these children, and it is a regular practice, a normal practice to deworm after every six months. Now, this target group, this is the most active age group we have. And their body, physically, they're developing, mentally, they're developing. These worms, like particularly hookworm, one hookworm sucks about 0.1 mil of blood per day. Which means if there are 100, you are almost finishing a syringe of blood. Now, they are surviving on our children.
So one worm can suck a pint of blood in a year.
Yes.
And if you're lucky to have 100,
so what?
That's a blood bank.
Now, blood bank. And you know what it means? It means that the child is now constantly eating food and replacing. He's working for the worms. So his bone marrow is now, a factory for blood to feed. Yet, the child needs food for its growth and mental development. So the worms put a burden on this child's development. So deworming these children will reduce that burden and allow these children to grow to their full potential. By the way, if you can see, most of our children are taller than us. And these are silent things because standing is one of the development indicators of a country. So the average height of our children is they're now taller. So we want that trend to continue because it is not only their bones which are growing taller, their brains. You know that our children are sharp. They think faster, they act, and they cope with new situations.
I think it's no coincidence that we are having world champions, marathon, half marathon, 5,000, 10,000, world records going down.
That is just the beginning. When Uganda starts, it will not stop.
I see.
The marathons you are seeing, this is just the beginning.
So you want a champion, get them immunized, chase away all the worms so that they can use the blood to build their body.
Polio
and beat the world.
Polio cannot give us a polio victim cannot give us a gold medal.
Except in the Paralympics and they take very big effort.
Yes. So there will come a time Uganda will not send one person for the Paralympics. That's the future we want for our children.
I think that's one medal we want to lose as long as we are getting so many.
Yes, we want to lose that.
The track and field.
Yes.
Many people go blind because of very simple reasons. Preventable. A vitamin capsule that's available, one squeeze.
Yes.
What number are we targeting to give just this simple Vitamin A capsule.
So vitamin A supplementation, we are targeting children 5 years below for the same reason that these children require this to prevent to prevent avoidable blindness. So we are targeting 7,500,000 children. And these are children who are spread all over the country, and we will reach them with ease by focusing on them at village level, and our healthcare workers are going to reach at least 2 times in the month of October in every parish in Uganda. Every parish. And the children will be got, and that number will be got with ease. And we've ever done this before. You remember last year, we wanted to vaccinate 18.2 million children
And I think you ended up
in 1 week.
vaccinating more.
We went to 19.4, and the rest of the world is marveling at us. So there are great things we can do, and we know these targets are within our range, and we are going to vaccinate these numbers of children.
Thank you, Dr. Duale.
Right.
You are watching us. Stand to be counted among those that make a big impact. By you immunizing your child and getting yourself immunized, you're protecting first yourself and your whole country, and we want you to be patriotic and actually play that part happily. So when the event comes to you, please participate, respond to this cause. Together, we shall have a very healthy and productive country. As you go for this short break, I'll be waiting to answer your questions in the next segment.
You are watching the Doctalk Show.